Hello. I am Mr. John. Welcome to the session. I think this video will be very useful to you. Let's go to the video. But before that, please do subscribe and turn on the notification by clicking the bell icon.
In this video we are going to see about the peptic ulcer. Let's go. Peptic ulcer is a lesion in the lining of the digestive tract, typically in the stomach, or duodenum, caused by the digestive action of the pepsin and stomach acid. Lesion may subsequently occurs into the lamina propria and submucosa. To cause bleeding, most of peptic ulcer occur either in the duodenum or in the stomach. There are three types of ulcer. They are gastric ulcer, ulcer in stomach, esophageal ulcer, ulcer in esophagus, duodenal ulcer, ulcer in duodenum. The causes are 90% of the peptic ulcer is usually caused by the Helicobacter pylori. Frequent use of NSAIDs, smoking, alcohol consumption, radiation therapy. The sign and symptoms are burning abdominal pain, nausea, change in appetite, bloody or dark stools, unexplained weight loss, indigestion, chest pain, hematemesis. Peptic ulcer can be diagnosed by the following: serological test, stool test, CT scan, chest X-ray, upper gastrointestinal endoscopy and biopsy, physical examination, medical history. The risk factors are Helicobacter pylori infection, alcohol consumption, intake of spicy food, age, dyspepsia, cardiovascular disease, drugs like anticoagulants and antiplatelets. Pathophysiology of peptic ulcer is given in the link below in the description. The complications of peptic ulcer are internal hemorrhage, bleeding, gastric obstruction, perforation, cancer. Now let's see about pharmacological management. Pantoprazole, class as proton pump inhibitors. The mechanism of action is pantoprazole suppresses the final step in gastric acid production by forming a covalent bond to two sites of the hydrogen and potassium ATPase enzyme system at the secretory surface of the gastric parietal cell. The available doses are 40 mg and 80 mg. Ranitidine, class as H2 receptor antagonist. Mechanism of action is ranitidine is a competitive inhibitor of histamine H2 receptors. The reversible inhibition of H2 receptors in gastric parietal cells results in a reduction in both gastric acid volume and concentration. The available doses are 150 mg and 300 mg. Pirenzepine, class as anticholinergic. The mechanism of action is it inhibits the gastric acid secretion at lower doses than are required to affect the gastrointestinal motility, salivary, central nervous system. Doses 50 mg. Misoprostol, class as prostaglandin analogs. The mechanism of action is it inhibits basal and nocturnal gastric acid secretion through direct stimulation of prostaglandin E1 receptors on parietal cells in the stomach. The available doses are 100 mcg and 200 mcg. Amoxicillin, class as antibiotics. The mechanism of action is it acts through the inhibition of cell wall biosynthesis that leads to the death of bacteria. Doses 500 mg. The non-pharmacological management are probiotics. Eating a balanced diet that contains whole grains, fruits and vegetables. Limiting or avoid alcohol. Avoid intake of spicy and junk foods. Avoid coffee, both caffeinated and decaffeinated. Avoid caffeine from other sources such as chocolates or soda.
I hope that this video is useful to everyone. And please do subscribe my channel and turn on the notification by clicking the bell icon for more notes. Thank you.